Where are you going to set up?
Good evening. It's already evening. Wow, how frightening. This is not like going on before the Rolling Stones. This is like coming on after the Rolling Stones. A much tougher proposition, and not to say that it's always tough to come on before cocktails and dinner. It is an international panel, and Sven, as you might suspect, is from Sweden, and Natalya and Stephanie, as you might suspect, are from Hong Kong and Japan. That's called the Streisand effect. What I've gathered from the presentations today, my brain is just on overdrive, is that when you really make an effort not to tell the truth, you succeed. We had been talking actually at dinner last night that Admiral Levine is in town, and if you look at the response, not just to the CAST report, which is obviously very interesting and global, but to the HHS, the U.S. Department of Health and Human Services, a response to the WPATH report, and even more disquieting to the Johns Hopkins report that it itself requested, that reaffirms the WPATH report. By the way, loved your presentation, well done. You begin to wonder what on earth is going on and why is she here? When President Biden was elected during the last days of the COVID pandemic in the U.S., one of the president's most exciting statements was, "Science is back." Now, I'm a former associate commissioner at the U.S. Food and Drug Administration, and I can show you my scars. So I am a former federal official here to help. And hopefully, myself and my fellow panelists will help more than the WPATH conference across town. What is that smell? Science is back. Well, I guess what it really means is that science is back when it's convenient. Science is back when it supports my own deeply held proposition. Science is back when it supports my politics. And that's really frightening. I do a lot of work on disinformation and misinformation, so COVID was very good to me. And I was going to say that Admiral Levine is peddling misinformation and disinformation. But Yvette in the corner over there, stand up, Yvette. What does your shirt say? Gays against groomers. Admiral Levine is perpetrating data grooming. Yeah. Now, that's not a felony, but if you data groom with the FDA, you fail, and appropriately so. There seems to be no damage and certainly no remorse when it comes to data grooming coming out of the federal government, and it is really frustrating for a whole host of reasons, not the least of which the negative clinical outcomes that it will perpetuate. So you have to ask yourself, whither best practice when it comes to the overall proposition of this conference? Winston Churchill has a great quote. How many Americans are in the room? Wow, so many. Americans love coming to Portugal. Winston Churchill has a great quote. He says, he said, "Americans always do the right thing once we have tried everything else." And it's good for a laugh, but not so funny when you recognize the harm that it can do in real time. Stephen Levine and I were on a panel earlier this week in New York, and he introduced a phrase to me, which I will attribute to him, even though he claims it's not his. Something called not evidence-based medicine, but fashion-based medicine. And I think that when you looked at a lot of the covers of the book, that the previous speaker showed, so much of it is kind of fashion-oriented or faddish. And again, it is revanchiste, and it is replacing reality. So that's my introduction. And the way I'd like to run this panel, we have questions which I'm going to ignore because we only have 45 minutes, and unlike in typical American fashion, we simply won't speak faster. So what I'd like to do is have each of our panelists talk a little bit about the work that they're doing relative to kind of trying to right the ship. And then Sven, I'd like to give you the final word because you're really the clinician on the panel here. So let me start, Natalya, let me start with you. And if you would just give a brief introduction of who you are. Coincidentally, we're neighbors in New York, so you can't escape it. A little bit of who you are and the work that you're doing relative to the program that you're developed, and Stephanie, then we'll move over to what's happening in the UK. So Natalya, go ahead.
Hi, I'm Natalya Murakhver, and I run an organization called Restore Childhood, and I'm not an expert, but I am a parent. And my role is to empower parents to feel like the experts that they are, because during the COVID pandemic, my fellow parents in New York City and across large swaths of the United States decided that Dr. Fauci was the expert on what their children should do. We closed down our schools, we masked our children, we socially isolated them when they came back. Our children couldn't even take drinks of water in classrooms because teachers' union contracts prohibited them from lowering their masks. My children ate lunch outside in January on cold concrete. There were parents who would pick their children up from school because they didn't want their children lowering their masks around other children at lunchtime. So parents fully bought into this because we had experts that we trusted. But we pretty quickly found out that kids were actually safe. Sven and I spoke about the fact that Sweden really didn't shut down their schools. Tracy Beth Hoag, who I worked with, who's a researcher who's a dual national between Denmark and the United States, reported that Denmark didn't really shut down their schools. They didn't mask their children. They barely did anything. There were no mitigations and no excess deaths. But there was this illusion of consensus that was created on the internet. And you might be familiar with that term because Dr. Jay Bhattacharya, who I had the privilege of working with during the pandemic and who helped lead us out of it, really put himself out there and spoke out. Dr. Scott Atlas and Tracy Beth Hoag, Vinay Prasad, all of the heroes who spoke out and said, hold on a second, there's no evidence to support anything that we're doing right now, and we've totally changed society and destroyed this generation. And the Biden administration censored them. We have a federal lawsuit going on in Supreme Court. I won't go on and on about this, but I think it really woke me up to the treason of the experts. And currently, the reason I'm here, I mean, gender is not, my forte or anything, but I know what a woman is. I know what a man is. We developed a toolkit for parents with Dr. Chris Kalibi and some other psychiatrists and parents and very progressive journalists who report on gender and sexuality to try to get through to the parents who think that, not affirming is not progressive. Because we disagree. So we have something called the Gender Toolkit, which we've been rolling out over the past 3 months.
What's interesting, well done. And obviously, one of the lessons from COVID-19 is that every country deals with things differently for lots of reasons, not the least of which is the cultural milieu in which they're operating. And I was talking with a group of folks, many of whom are in the audience today, earlier today, relative to a certain type of therapy that I won't mention that believes really in the exclusion of parents from the process. And I am not a mental health professional. My sister is, and as she often reminds me. But when someone says to me that, a key to the exclusion of therapy for gender dysphoria within an age group that is already alienated from the get-go is to exclude the parents. As the non-professional, I say, this just sounds like bullshit to me. And all of the data points that you want to show me will not make me believe that disintermediating, to use a politer word, a parent or parents, regardless of what that parental unit looks like at home, traditional, non-traditional, it's just so profoundly alien. It is almost the definition of repeating a lie enough so that people begin to believe it. And I had said to the panel, and Sven was on this panel, that, and Stephen and I were on a panel earlier in New York, it kind of sounds like a cult to me. And they're, oh yeah, oh yes. So seeing the presentation relative to cult behavior and deprogramming, I'm glad to see that the common sense questions that it raised in my non-professional brain is a discussion among you highly trained professionals. It was very enjoyable. So I think, in the U.S., certainly the issues with COVID has led to a tremendous degree of distrust in the FDA, in the CDC, in HHS more broadly, where CDC and FDA reside within the government structure. And that's dangerous, but I also wonder whether it gives us the opportunity, I think, Natalya, from your perspective, to reinvent, to refresh, to reinvite people into the conversation. That we in fact are, from a Piaget perspective, mature enough and developed enough to reach our own conclusions based on data points and not data groomed points, but data points. Stephanie, obviously the UK, even though we almost speak the same language, it takes a different view on many of these issues, and your culture is different, and you have many cultures within your nation, different viewpoints. Talk a little bit about what you're doing and the response that you've been getting.
So when I started Transgender Trend in 2015, there was literally no debate, and I was working, and I had worked for over 20 years with parents and in teacher training. And I kept waiting for somebody to speak out. And then I thought, well, it has to be me. And I spent those first few years talking to parents who were in this terrible position of not only having a real problem with their teenager, but having the whole world against them and the whole world thinking that they were bigots. And so normally when you have teenage problems, your child gets involved with the wrong crowd, into drugs, into drink, into sex, all those teenage problems. At least you have the support of your society around you. You have people who have some sympathy, some people who blame you, but you get sympathy. You can talk to your friends. So I was talking to parents who couldn't even talk to their friends because they were afraid of being told that they were bigots or transphobic. So I thought, and at that time there was no debate. That was the rule, no debate. So what I really wanted to do was to say, no, there is a debate here. There should be a debate on this. This is really serious, what's happening to children and what's happening to families. And I want to just mention two things that have happened in the UK very recently, because I think they're really positive signs of how that debate has developed over the years so it's been about 10 years now since I've been working on this, and how the debate has changed over those years. And the first one is, in fact, that was in the news today, the British Medical Association, which is the union for doctors, medical professionals, had come out against CAS and made a statement against the CAS review, and that they were going to reject it initially. And then they said, no, they're going to have a debate about it and look at it. And, this was 4 years of work, the CAS review. It is the most thorough, comprehensive review of child medical transition. So the BMA were going to have a look at it and decide whether it was okay or not. One journalist, Hannah Barnes, exposed this, and then it was all over the newspapers, and it's had extensive coverage in the mainstream media. And so suddenly they couldn't hide anymore, because one of the ways that they've been so successful is that they have been able to hide what they're doing. And one of the biggest supporters of that has been the media. So the media hasn't covered stories, so the general public doesn't know about them. So one journalist exposed this, and then the story has led to the BMA today announcing that they were giving up on that plan of doing their own review. And what was interesting there was that a petition was started by doctors, and some of the most senior consultants and doctors signed that petition and spoke out publicly in mainstream media coverage using their names. So this was really, really new. They dared speak out. They dared show their faces, show their names. And the other example I want to use is the ban on puberty blockers. So when the NHS, after the CAS review, stopped routine prescription of puberty blockers, the then Secretary of State for Health banned the use of puberty blockers within the private unregulated clinics like Gender GP. And the new government, the new Secretary of State for Health, came in and said, well, this is going to continue. But what happened was that a group called Transactual and the Good Law Project were trying to bring a judicial review against the previous Secretary of State for that puberty blockers ban, using so-called evidence that more children had committed suicide since the NHS had stopped the routine prescription of puberty blockers. So what did the current Secretary of State do? And this is the Labour Party now. He commissioned a report and a study by the government's suicide advisor, Louis Appleby, who produced a report showing that that was nonsense and really ticking people off for the very dangerous message they were sending to children. And I think what connects those two examples is, and what the CAS review has done, we all know it's brilliant, and you know it's evidence-based. It's the first, well, it's not the first, but the biggest, most thorough evidence review by an independent researcher. And what it's done is it's put the grown-ups back in the room, because now I think that previously, now we know that the Yale University review of the CAS review, for example, there have been lots of attempts by trans activists to discredit the CAS review, but you can't. It's impossible. And the grown-ups know that. And in fact, what links these stories also is you're looking at the legal system, you're looking at politicians, you're looking at professionals, medics, journalists, media. Every area where this ideology has infiltrated needs to work together in order to solve this problem. And these two examples are a great way that has started to work in the UK. And I think it's because everybody does know now that if they criticise the CAS review, they make themselves look like idiots. And they can't do it. So there's some really positive news, I think, a real shift in the UK. I've got some negative stuff as well, if we've got time. But
Well, you know, nor do we want to suppress that. But you mentioned something that I wanted to pick up on, which is the words mainstream media. Now, that means lots of things. But I think in the world that we're talking about the media that young people don't read. But let me tell you what the mainstream media in the United States is saying. And by the mainstream media, I specifically refer to the New York Times, which is my hometown paper, and also, as they like to view themselves, our national newspaper of record. And there was an op-ed in the New York Times, August 18th. I recommend it, by a woman named Lydia Polgreen. I don't know whether you've seen this. And the name of her op-ed was "The Strange Report Fueling the War on Trans Kids." The strange report being the CAS report. So I read it. You know, there's garbage in, garbage out. But what really fascinated me was a letter to the editor that ran a couple of days later. And I won't read you the whole letter, but the woman that writes says she Lydia Polgren, the author of the op-ed. She clearly identified the faulty and dangerous unspoken premise of the Cass report and much of the reporting on this topic, that being transgender is socially deviant and harmful. Well, if you can't win by the facts, you might as well smear the reputation based on baseless claims. You're homophobic, you're a racist, you're a Red Sox fan. That when facts don't support your argument, you move on to ad hominem attacks. And I've always been taught that when your opponent resorts to attacking you personally, they have lost the argument. Now, unfortunately, that is not the case. Ad hominem attacks, nasty attacks, personal attacks are very colorful. They're very sexy. They give themselves over very easily to online memes, and they spread rapidly. As they say, a lie makes its way around the world faster than truth can get out of bed. So thank you for bringing up, I guess, the good news that some of this nonsense in the UK is being called out just as such. I wish I could say the same in the US. Obviously, I guess initially, the concept of the BMA was to follow the US over the precipice, but it's nice to know that that's been stopped. So I know you've played a part in that. Well done, you. Before I turn to Sven, I'd like Anna and Kabushin. Levez-vous, s'il vous plaît. I don't know if you know these ladies. I recommend that you talk to them at great length during the cocktail session and buy them dinner. They were on the panel that Sven and I were also on earlier today, and they brought up two things, Sven, that I'd like you to think about and comment on. The first is that symptoms have a meaning and a message, and we ignore those meanings and messages at not just at our own risk, but also at the tremendous risk of patients, young patients. And secondly, that the role of the clinician is to resist. And I think that was a very, very important moment for me, because it's hard enough doing your job clinically to also ask clinicians to be resisting the very powerful currents of politics and data grooming is just an awesome responsibility. So, Sven, let me hear your thoughts.
Okay. Of course, symptoms has a message. And we got to have an approach. We must be curious when we meet the patient and the parents. So we have to see the symptoms in the big context, the context of the family, of how is it in school for this child, the society, what happens in the world, all the anxiety that you could, of course, have because of lots of reasons. So we have to be very curious, and when it comes to gender dysphoria, the new group that has evolved the last 10 years, most of them have one or several other psychiatric disorders. And the treatment for those, the treatment is evidence-based. But there's no evidence at all for treatment for children with gender dysphoria. So we have to look we have to have a holistic approach. And secondly, about, you said about that could you repeat that thing you wanted, the second?
I've already forgotten, but let me tee up something else for you, which is we kind of have just Natalya introduced us to the concept of a more empowered parent, And I know that we all agree that involvement of the parental opportunity is crucial.
Okay, you want me to answer that?
Yes, please.
Okay. No man is an island. And children, of course, are dependent on their parents and their siblings and their peers. And as a child and adolescent psychiatrist, I must look at everything. And I don't have one patient. I often have 2 or 3 or 4 in the room. In some cases, it's the healthiest person is the child. So we must involve the parents, and as they do, both in child and adolescent care for gender dysphoria and for adults, they exclude the parents. And I know several parents that have told me that they have asked critical questions, and then they are excluded and can't come anymore to the clinic. And we also have social services that place the children in foster care because the parents are critical of the treatment of gender dysphoria. It's a big scandal.
And here. And another phrase that caught my attention earlier today, I think, Sven, I think that you actually said it, is that the past cannot be erased, but it can. People are trying right now very hard, very aggressively, with a lot of attention to erase the past. And not just the past of any individual child dealing with gender dysphoria issues by excluding their parents and siblings, but erasing data. Doesn't that infuriate you? That we should be marching. We should be intense on university campuses objecting to erasing data. It's very Orwellian. You know, he who controls the past controls the future. She who controls the past controls the future. It's just it's a lightning rod conversation, and I wasn't quite sure what this audience was going to be like. And what I found in my brief exposure to you guys, I think pleasantly, is that you've got tremendous good humor, which is just which is so refreshing, because we can serious ourselves to death by pretending that we are the owners of truth and justice, and that's just shameful. Natalya, let me ask you, since you kind of teed up the mom thing, being the parent thing, you know, how do you feel, you know, when medical professionals, whether it's from a gender dysphoria issues or whether it's the best way to address a pandemic, where you're told as a parent, sit down, shut up, do what you're told?
Well, I mean, I'm oppositional anyway, so I would immediately leave. I mean, I think we know that parental involvement is really the key to success. You need to get, you know, buy-in and educate the parents and involve them in decision making. So I think that's a really big red flag. I think that oftentimes parents also underestimate how much they know. And they dismiss like old wives' tales or old wisdom, which I think we need to bring back to a certain extent. I've been talking about intergenerational relationships and how our children used to come home and spend time with grandparents, and now they spend time with their phones. So they have all these numerators but no denominators. There's no context. I see that with my own children too. Their grandparents are either, you know, abroad, my husband's from England, or, you know, unfortunately passed away. So I think that's a real challenge to bring back context and also just to, again, empower parents to feel like they don't have to assign agency to somebody with credentials. whether they're a teacher or a social worker. It doesn't matter. I mean, I was just on a meeting with someone who was working on a project for us and had really messed it up. And instead of arguing or explaining why they hadn't, they said, well, I'm an expert. I have 15 years of experience. And I was like, if you know anything about me at all, you know that this relationship is over. So I think just empowering parents and instilling security in them and giving them the tools and also the language. I mean, so much of the language has been co-opted. Something we made sure to do in our toolkit was to truly define the terms that we hear. So,
well, thank you for keying up. Context was something else on my list, the urgency of context. And I know that when it comes to the jobs that you guys do with your patients, the lack of context makes your job so much more difficult. It oftentimes forces you to use your best judgment, otherwise known as guessing. And information is always better. And thank you, Natalya, for teeing up the word agency. Because I also believe that we need to, I don't want to say usurp or adopt, but take back the lexicon of this conversation. I would argue that the word agency, having personal agency, is a term that Admiral Levine uses a lot. I don't know, I would just kind of reach that assumption. It is a term, it is a woke term, but it is a true term, and it is an important term. And I would argue that not excluding parents or rushing to judgment and avoiding long-term therapy is denying agency to both the child and to the family and loved ones of that child. So with that being said, I know that we've run a little bit over and the evening was running late anyway, and we will all stay around. We'd love to chat with you. Thank you so much for your time and attention. I was just told that I should not, I should give you guys the opportunity for a Q&A. So if there are any questions, I apologize for trying to wrap up too quickly. If there are questions, please raise your hands and we'd love to discuss it with you.
Q&A, yes.
Hi, I'm Jack. I'm a white cisgender gay male. Very good to be here. Thank you. I don't know who could answer this specifically, but I guess I'm aware in the US, I think someone mentioned there's been lawsuits of families who've actually lost custody of their kids. So I was just wondering, do you have any predictions on what is going to happen there? I mean, are we going to see more of this? And how are those families going to be compensated eventually when hopefully it all comes crashing down?
Sven, did you hear that question?
Could you repeat?
Yes, I think this is a good question for Sven. There have been lawsuits by families whose children have had negative consequences, and I assume suicides are some of those consequences with aggressive treatment. Do you feel that these types of remedies are going to increase?
Hopefully, hopefully, and I think so, and I think that could be a big change if it goes to trials. I mean, in Sweden, between 2017 and 2021, 440 children got hormone therapy, 440. And that was only between 2017 and 2021. So if you count those children before and those after, you will probably be up to maybe 1,000 children. 1,000 children. And if only, and I think that of those 1,000 children, the majority have already or will stop this treatment. And if only some percent of those would go to court.
I think also to that point, I mean, earlier we were talking about the placebo effect relative to exorcisms. What we talked about earlier, Sven and I did, which is the lack of really robust data collection of what medical outcomes look like 5, 10, 15, 20 years down the path. So I think until, and obviously there are some horrible stories that require litigation. I agree with Sven that the more the better. But I think we need to also capture data so we understand and help prevent negative outcomes. Sven?
Yes, I would like to comment, because the long-term effect, we don't know anything at all. Because it's only since 20 years ago that teenagers have got hormone therapy. And they should then have it cross hormones, high levels of testosterone if you're a girl, born girl, for 40, 50, 60, 70 years. What will happen? What will happen? Nobody knows.
And I guess part of the issue is, just again, from a data grooming perspective, the plural of anecdote is not data. We cannot continue to rely on emotional stories from either side. And I would argue that not to take sides, but the sides that is more in the majority in this room, that we should rely on really robust data collection. And I think that, Stephanie, to your point, the data is remarkably driving the conversation in the UK. Wow.
And I think it's something that parents can say when they find teaching in schools. All they need to say really is CAS review. It's a huge. I mean, it's a weapon, but I think parents need to use it because all of their concerns are 100% vindicated by the most extensive, I've said this before, thorough, comprehensive review that's ever been done, and it's groundbreaking in that sense.
It's also waving a wand of garlic, in a sense.
Yeah, it's total vindication of all those parents. And those parents who have spoken out, voiced their concerns, struggled with this, should be now saying, I was right, look at this.
Also, I should add, for those of you who are following the US presidential election, which I unfortunately am forced to do, this is not on the agenda. This is not a discussion item. It is not even close. Yes, ma'am. Yeah. Anybody have a comment on that, Natalie? Why isn't this issue on the political agenda in the U.S.?
Okay. Yes, could you also repeat the question?
Yeah, so the question was, why aren't, during this very high velocity U.S. election,
Yes.
why isn't this being discussed? Why isn't this part of the conversation? Why isn't Admiral Levine being called out for purposefully misrepresenting, burying, lying about data?
I'm sorry, yeah. So I said the reason that this isn't coming up and Admiral Levine isn't being taken to the table is because Trump is saying that kids are getting gender transition surgeries at school. And that just moves it into the realm of the ridiculous. So it's almost and then you can just discount it as a serious journalist.
I think that's exactly right. I think part of the answer is we need to tell people, stop helping. Yeah.
I think your question is good because I think this is one of the biggest medical scandals ever in history, and it's abusing of children. And I think also that and I said that earlier in our panel discussion, that the responsible authorities, persons in authorities, and the physicians, I think they should get prosecuted because this is child abuse. A reason that they're not talking about this issue now in the United States, of course, it's a too infectious question. They are afraid of losing voices.
And Trump has
votes.
Well, I have to admit, I opened this can of worms up, so I guess we've got to pursue it. Yes, sir. Last question. Or actually, right, one more, you and then you.
Okay, can you introduce yourself?
Hi, Kathy from New Jersey, parent. My question is about data collection and getting good data collection. I think it's really important. And I just want to mention that a lot of parents, myself included, are hesitant to provide our teenagers to the data collectors that are currently looking for families and young adults because of the sexual nature of the data collection and our lack of trust in the clinicians.
And I guess the lack of trust in the clinicians, and also I suspect the lack of trust in the proprietary nature of the data.
Yeah.
Yes, sir. Final word.
All right. So,
sorry, who are you?
My name is Jesper. I'm the chairman of something called the Danish Rainbow Council, which is like an anti-identity politics, anti-woke, I suppose, LGBT organization. And I am a Danish social democrat who is rooting for Donald Trump. So that is part of the absurdities that my life has been pushed into because the left has gone crazy. And so I actually follow the guy, the big bad orange man, quite closely. And I know exactly what he's said on this point. And he has publicly stated that it is going to be a first-day issue for him to shut down medical transition of children. So I know he makes gaffes once in a while, well, every day. But he's actually been very, very clear. I even have the clip I can provide you because I use this in my communication. So this is, you're never sure about like what Trump really cares about, but but he has mentioned this many, many times. So I've chosen to trust in the fact that he actually will put a stop to this.
Well, thank you for that comment. I will certainly have no comment on that.
Well, that is your prerogative, sir.
I'm just going to abstain entirely. Ladies and gentlemen, thank you very much.